it's Kathy Kress again, and I am back with my YouTube channel, Geriatric Care 1, and we are doing the playlist Caregiver Assessment, and we are in number 3. Okay, so we're talking about why you should do as a geriatric care manager any aging professional and caregiver assessment, along with a care receiver assessment, 2 assessments. So whose problem is it? You know, the problems, you go in as a problem solver. You know, there are problems, you're going to go in and solve them and come up with solutions, and that's a care plan. You really need to include the caregiver in, and you do with paid caregivers, you know, all the directions to the paid caregiver. Well, you need to assess the caregiver as well, the family caregiver, because they do have problems. Because we usually fix, you know, as geriatric care managers, the care receiver's problems. You got to fix the caregiver's problems to get the best care and keep the person at the best optimum level of care. So what does a geriatric care manager do to do a caregiver assessment? I mean, you know, what do you get out of it? Well, you identify the caregiver's problems, and most of the time, they're the caregiver receiver's problems. And that really does hold true because it's family. Families are a system, especially with older, you know, couples and younger daughters. You get a better care plan because you're going to really, you know, round out exactly what the care receivers should do to take care of themselves. You stop the loss of the caregiver because eventually, if you don't solve the caregiver's problems, which are the family, they're going to quit. Or they're just going to be burnt out and just walk out, or they'll do elder abuse. We're going to talk about that because they don't get paid anything. So what you're able to do also is to, if you do a caregiver assessment, you're really going to ask questions that describe the caregiver's day, because they're going to tell you, well, you know, it's hard to turn, or, you know, I really, you know, my back hurts. And so it's almost like doing a caregiver assessment is like having a movie of what's going on during the day. And you don't sit there for 8 hours, usually, you know, when you're a geriatric care manager. So you get the whole picture. And then you also detect elder abuse. And elder abuse is a big part of why you should be doing these caregiver assessments. Don't point, Kathy, but I am. Because basically, depression predicts caregiver stress, okay? And if caregiver stress reaches a certain level, clinical depression, for more than 2 weeks, this turns into clinical depression. And that's one of the warning signs of elder abuse, clinical depression in a caregiver. And so what you really need to do when you're doing this caregiver assessment is do a GDS, Geriatric Depression Scale, on the caregiver as well. Because if they're so depressed, which they should be, they're not getting paid, they have another job, they basically have a lot of probably medical problems, on and on and on, they're going to be in caregiver, they're going to be in depression. And that's a red flag for elder abuse. So what are the red flags for elder abuse? Your caregiver is calling the police and reporting that. Your caregiver is invading the care receiver's privacy. Your caregiver has vulgar habits. I mean, all these sound like weird, but, you know, like spitting. My husband spits. I hate that. And he's not even a caregiver. You know, some people... Okay. Disruptive behaviors, if you see disruptive behaviors in a family caregiver. Embarrassing behaviors. You know, wearing 2 skirts or something. I mean, caregivers, family caregivers can, you know, have all sorts of personal problems. And cohabitation. I did a paper a long time ago called Aging Peter Pan. And that was about usually sons who had always been taken care of by their elderly parent, even when they were young. And as it progressed, and they were about 45 or 55, they usually had drug problems because their parent had supported them. And they lived with the parent, cohabitation. obligation. So a caregiver that family caregiver that needs to live with a parent, it's, they may be eventually taking money from the parent. So I'll be back next time. Go to my website, kathygress.com. I blog right along with this, and we will see you at the next episode.